Did you know that burns are some of the most common injuries doctors see during the summer months? For advice on ways to prevent these injuries, we're pleased to have back with us Dr. Michael Bryant with the Urgency Room. It's always a pleasure to have you with us. So
Thanks
thank
for
you.
having us.
So maybe we start off with sunburns, maybe? I don't know. Advice on, I don't know, sunscreen. What kind? How much do you use? How often do you put it on?
Sure.
Things like that.
It's beautiful weather today, and we're having those high heats. And us being Minnesotans, most of them are Scandinavians. A good percentage of people have that light skin, and we'd call it a dose of vitamin D today. But surprisingly, people think that more SPF is greater. So should I have 50 or 100?
No, I guess you're saying.
It turns out there's no real harm in having the higher SPFs, but 15 would be about 94%. And if you're sort of a darker skin type like mine, that would be fine. But more the lighter skin types need at least a 30. And then the question is there really anything that's waterproof? And being sort of an emergency dermatologist, I'd say no, there really isn't any. So reapplying anywhere from 30 minutes to 2 hours. I think every 30 minutes reapplying is kind of tedious. One of the things I was thinking about, well, what about babies? You know, we take care of a lot of babies at the urgency room, and we don't want to be seeing them necessarily for sunburns because it can be dangerous.
Imagine, yeah.
And in general, we recommend that anyone under 6 months old, you just keep them out of the sun, keep them covered, and then after that, you know, applying sort of those baby safe ones that sort of would be on the higher end, but a 15 would not be enough for a baby. That's like 94% of the UVB, ultraviolet rays. It's UVA and UVB. The UVB are the ones that cause the sunburn. So that if you go to 30, you're at 98% coverage, and that's pretty good.
As an outdoor biker yourself, you're probably putting that on quite a bit then, right?
I need to.
Yeah.
I need to be.
Even with the darker complexion?
Yeah, I try to put that on, especially those really sensitive areas, the nose, cheek, ears, that you often don't think about that. When people you see them putting on sunscreen, they're putting it on their arms or their neck or something like that. But those areas that are prone to skin cancer are really the face and the hands, and we sometimes forget that. One of the things that people say, well, doctor, I'm on a lot of medicines. Am I at risk for sunburn? And truthfully, you are.
So what do you do then?
You really need to be quite proactive, and to a degree, I say, you know, you brush your teeth, put on some sunscreen at the same time, so you at least have it some layer going on. But particular things to look out for are antibiotics, heart medications,
Oh wow,
cancer
common
medications.
things that everyone uses. Yeah.
And so, what if you get a sunburn? How do you treat it? One of the things that sort of decreases that inflammation, and your skin is upset, it's inflamed. Anti-inflammatories like ibuprofen or naproxen, they're really good for treatment, but some folks take those every day, and those are actually photosensitive medications. So it's hard to be doing the right thing. But you really want to check all your medications, and your pharmacist is probably your best expert. But most of the packet inserts will say, this is a sun-sensitive one. But the antibiotic that's really known for it would be a sulfa antibiotic, antihistamines, and then the anti-inflammatories.
I can't tell you how many times I've had people say, well, you know, it was cloudy out. I was surprised I got burnt.
Yes, those ultraviolet rays do come right through the clouds. And so no matter what here, you really need to be doing it in the summer and fall and winter, all year round. We really need to be protecting our skin.
And I would think, too, with all of our lakes and rivers, that you get that reflection on the water, double the whammy.
Magnifies it for sure. Yeah, one of the things that people say, well, would you really see sunburn in the urgency room? Would an emergency doctor really treat that? And sometimes it can become quite severe with blistering, and there's times where we might use more than just over-the-counter medications. And if you've got blistering or severe pain, that'd be something that you could come to the urgency room. We do really well at treating pain and sort of advising for management of that. The thing that we also want to think about is it really sunburn? You know, if it's you've been outside at the beach all day and then you're burned, that's one thing. But if you have just one leg that's red and hot and maybe you have a fever, that could be an infection. So if it seems out of place, it'd be something that you'd want to come have us check it out.
I know years ago my sister, who was even fairer than I was, I mean, just really light skin, blonde, blue eyes, and we were on a lake, and we knew she got a lot of sun, but like the next day, I mean, she was just puffed up her eye. And we did go to the emergency room, and
yeah. So one of the things that you can help treat it is also making sure you're hydrated. So sunburn, thinking about burns, we really want to just take this opportunity to talk about heat illness and heat prevention. And the best thing you can do for that is make sure you're out of the sun when you can be. But if you're going to be out, make sure that you're getting a proper amount of fluids in there, and that people at extremes of age, young ones and the old ones, they don't have quite the reserve.
Okay.
And so that if you're on diuretics or water pills or things like that that can put you more prone to dehydration, they're going to make it harder to recover from something like a sunburn or a heat illness.
And I thought I read too that if you're thirsty, you're already dehydrated.
Yeah, you're behind.
Yes.
You're behind. One of the silly things that I'd say is that for people who aren't on diuretics, you want to make sure that you have to use the restroom every few hours, because that's sort of your body's gauge to say, yeah, you've had enough fluids.
Good idea, yeah. Especially if you're in that heat, because sometimes if you get that heat exposure, you may not be able to feel the temperature and stuff.
Right, absolutely. And then if you stop sweating, that's extreme, and you really need to get in, get cool.
So what kinds of signs and symptoms should a parent or a loved one be looking for on someone, like their child or their loved ones too, on what are some signs that they've had too much heat or too much sun?
So you're not urinating, you're not sweating, lightheadedness, or fever. They're feeling feverish. In extreme cases, you can have a heat illness or heat stroke where there'll be confusion or seizure, but the majority of us are going to feel ill enough that we're going to go inside. Radiant heat, is that direct sunlight, but those days where you really need to be cautious are when the heat is high and the humidity is high, because that really compounds the amount of heat. They call it a heat index or the dry bulb heat, something like that.
So get them out of the sun right away.
Yep, cool them. You can put cool rags on them. They talk about, for severe cases, in the emergency department, we might pack someone in ice. We might put ice in their axilla or in their groin or sort of on the chest area to help cool them rapidly. Getting wet, evaporation is your best key, and that's why when you're not sweating, your chance of getting heat illness goes up rapidly.
And when in doubt, seek emergency care.
Absolutely, absolutely. Another burn we might talk about is fireworks season. Mm-hmm. How do I prevent fireworks injuries?
Yeah, it seems like 4th of July continues all month, it seems like, at this time of year.
The statistics say from June 19th to July 19th is that hot time, and approximately 10 to 15,000 people across the country will go into the emergency department with injuries.
Wow.
The best advice is let a pro do it. But if you're like me and you're a firework freak or you love fire, you just want to be careful, do things that are smart. Wear gloves when handling things like that. Keep your distance. If you're going to be around fireworks, it's a really good idea to wear eye protection. It's one of the common injuries that we see people coming in to the urgency room with is either a chemical exposure or a foreign body in the eye, and you really want to do your best to protect those.
Right. Yeah, my brother-in-law, it's like my whole family here. My brother-in-law, he got a really bad burn like last year from fireworks that kind of, just kind of shot at him, and he caught his leg, and he still has a burn there now.
Yeah, those things burn really hot. Just a sparkler burns at 1,200 degrees.
That's incredible.
And think about, you're boiling water at 220. If that splashes off the stove, like, oh, that's a terrible burn. But here we act cavalier with these fireworks that are at 1,200 degrees. So we really just want to use caution. They're not a thing for children. If children play with them, they're going to be my patient, and I prefer that you enjoy the summer not as one of our patients.
That's for sure. And then also we see a lot of bonfires at this time, or campfires and things.
Yeah, absolutely. Having that common sense of have a safety ring, keep kids at a safe distance, but think about things that are going to enter the fire. A child falls into the fire, so you're going to have a safety area around it. But then things that might come out of the fire, sparks, pieces of wood. Actually, my son has a burn from a marshmallow. Those marshmallows get just as hot as the fire,
They do.
and it became liquid and fell on him. And so what happens if you get burned? How do you know to come in? So we used to talk about 1st, 2nd, 3rd, 4th degree burns, but really now we talk about,
the difference.
is it superficial, is it a partial thickness, or are we worried that it's a full thickness? And a trained emergency specialist like myself at the urgency room, we can tell you when it becomes blistered, now we're thinking about partial thickness, and it's something that you should come in and see us and let us help you determine how best to treat it, how to heal up. And often it's really wound management and then specialty referral to like a burn center. But that initial assessment is really done by a specialist in emergency medicine.
Final advice for our viewers out there about staying safe and preventing these summertime injuries?
Get your vitamin D, enjoy the sun. When you're out there, before you get out there, put on some sunscreen. and then just practice some safe habits. Be safe around the fire, enjoy your families, and if you should happen to have a severe burn or concerns, feel free to come and see us at the urgency room.
Sounds great. Always great to have you with us. Thank you, Dr. Bryant.
Thanks for having me.
Thank you.